For board session? Okay, just going to mention it, or?
Yeah, just going to mention it.
Too much going on.
Too much, given the resolution. We'll get it out there.
Good evening. Welcome to the July 26, 2016 Health and Human Services meeting. At this time, we'd offer privilege of the floor if anyone would like to speak. Seeing none, we will close the open floor. Any additions, deletions, corrections to the previous meeting's minutes? No. Tonight we have a presentation from Credo, which Bob will talk a little bit about.
Long enough to introduce our Community Services Director, who will in turn introduce Jim and have a further explanation. So Roger, please.
Many of you have already read the paper, and last week we had the Commissioner of the Office of Alcohol and Substance Abuse Services from New York State and Jefferson County for the day. She attended a press conference announcing a new recovery center that was awarded to Jefferson County, which was really a great accomplishment, I think, for our county. It's going to do a lot of good, not only in Jefferson County, but also in the surrounding counties. The other thing she did in the afternoon excuse me, was go to the Credo Community Center, where we are shortly going to open an outpatient opioid treatment program. And that's been mentioned several times in the media, but we did want to take some time to kind of inform the legislators, and also to answer any questions that they might have in regards to that program. So Jim Scordo, who's the Executive Director of the Credo Community Center, and Dr. Paisan. Jim?
Good evening. Thanks for having me. Thanks for having me here. So with this heroin epidemic, we wanted to talk to you a little bit about a new program that we were asked by the New York State Office of Alcohol and Substance Abuse Services if we would consider bringing into our community. There have not been an opioid treatment program that's open between 2000 and 2013 in New York State. And then since 2013, there's been 12 different opioid treatment programs that have opened in the state in response to this heroin epidemic. There's no service that exists between Syracuse and Plattsburgh for this service. So we had 25 to 28 individuals who were making the trip to Crouse Hospital in Syracuse, anywhere from 6 days a week, some 2 or 3 days a week, to participate in their opioid treatment program. So we were asked by the state if we would consider adding that service. So we immediately took out in early 2015 and visited Crouse, their opioid treatment program, and went to Conifer Park in Plattsburgh, and then more recently one they opened in Liverpool, to learn an awful lot about that service and what it was like. And I also looked at our population, and we've been doing this for 40 years, and the traditional treatment that we've done in engaging the families and getting somebody a job and getting them reconnected, furthering their education, those all were still in place and services we were providing, but I would see somebody that was 18 months clean and on the right path, and all of a sudden drawn back into this heroin and relapsing, and that's when they're most vulnerable and susceptible to overdose. As we continue to watch that, something else we need to do. We need to take the state up on their offer, and we started our application about this time last year and submitted it in November of 2015 and received approval from OASIS to be able to do that. Our biggest challenge we knew was going to be finding a doctor. Dr. Paisanello was working with us out of our Lewis County clinic, and I had a conversation with Dr. Paisanello to see if he would be interested in coming on board, because we would need a physician to be able to work with our population to prescribe the different medications that we'll be using. So I asked Dr. Paisanello just to give you a little bit of an overview about what that medication-assisted treatment is like, and we'll be happy to answer any questions you may have. So, Dr. Paisanello.
So, there are 3 medications we'll be using. There are 3 medications that exist right now to treat opioid dependence. One of them is called naltrexone, has the brand name Vivitrol, and that's a long-acting opiate blocker, opiates being heroin or prescription And with that medication, the person gets an injection which lasts 4 weeks in their system, and it deters them from using over the next 4 weeks, because any time they would try to use, it really would have no effect on them because it blocks the effects of the opiates. And that's appropriate for some. Is that if we have an individual who's at high risk for diverting the medication, selling it on the street, we can dispense it daily, have them come. We would keep this supply at the opiate treatment center. The patient would come in daily and would take the dose, and we would give it to them, and they would take their dose right in front of us and make sure that it was already consumed before they left the facility. And then the third thing we would be able to do, which we're not able to do now, is methadone. Methadone has been around since the 60s to treat opiate dependence. It's a synthetic, long-acting opiate. If a person is stabilized on the correct dose of methadone, they no longer have craving for the drug because they're being satisfied, their brain is being satisfied by the methadone, so they don't want heroin. They're not in withdrawal. They're not having cravings, and they're able to function normally. And studies have shown that methadone helps decrease crime, decrease risky behaviors such as needle sharing and risky sexual behaviors, and an individual is more likely to have a healthy pregnancy if they're pregnant, more likely to get a job, and it's helpful in a lot of ways. And we've been studying up, we've been visiting other opiate treatment programs. We're going to try to do this right and try to be a benefit to the community with what we're doing. So I'd be happy to answer any questions anybody has.
Thank you. What is the cost for a single treatment?
The cost to the client? Patient?
Both, cost to the client or cost period.
It's a relatively inexpensive medication.
Yeah, the medication is pretty...
It's generic. It's been around, like I said, since the 60s.
Is that the... How about the other one?
Suboxone is covered by most insurances, but it's relatively expensive if you had to pay for it out of pocket. It could be $8 to $10 a dose. Not that I know of. Well, a couple of years ago I heard it was over $1,000. Now I think I've heard quoted like $775, $800. It's extremely expensive. Pardon me? It may have been. It's come down a little bit.
How do you know that, Scott?
You have to be careful with it because, I mean, the way people fail is they don't come in 4 weeks later when it's time for their next dose. And the problem is that, and you have to be careful, is that after being without opiates for 4 weeks or more, they've lost their tolerance. So if the person decides to start using again and goes back to the same amount of heroin they were using before they went on the Vivitrol, they can get an overdose. So, correct. Other things that Credo does, and mental health support when they need it.
Here, and what's the length of time that the average person, the client, are being helped in therapy?
Some of the people, if they've been stable for many years, will choose to try to taper off, but some will not. Some will just try to maintain, and that's fine. That's an acceptable way to go. How many people will we have eventually? We really don't know. I mean, we're licensed for, I think, 100 to start out with, 100, yeah. But the state said that if we, at some point, if the demand was greater than that, we could expand further.
Medicaid or private insurance, or there'll be some that would cover under private pay if they don't have insurance. But most, if they do not have insurance, then we'll have them sit with a navigator to explore the insurance.
There's an oral form of naltrexone, basically an oral form of Vivitrol, but you have to take it every day, so it's not quite as effective, because if you miss a dose or two, then it's not there.
I mean, we have 300 individuals that are coming to our outpatient clinic now in our West Main Street site, and we're anticipating some of those ones that are already there will come over and be part of our opioid treatment program. But we also anticipate that there'll be some other individuals that have never sought out this service because they didn't want to drive to Syracuse, or some of those individuals that are driving to Syracuse 5-6 days a week, some of those will look to come and get that service here locally. So we'll be providing this right at our West Main Street site, where we've operated for over 30 years. Probably 70%, 75% of our outpatient clients are mandated. And when you talk our residential programs, it's a higher percentage than that. But in our outpatient services, about 70% are mandated. Yeah, and that's why we're going to, when we open this, we will open it to the individuals who are not currently in the system that may come in, that somebody whose job is at risk, whose family, his marriage is at risk. Because when this heroin strikes a family, I mean, it's individuals who are educated, individuals who are employed, that had a back surgery, had an injury, and had painkillers, and became dependent on those painkillers. And then that led further to the cost of those pain pills skyrocketed, and supply and demand. Heroin came in, it was cheap and it was affordable, and that's what people have switched to.
Thank you. Just out of curiosity, I know you've been doing all the research, and I'm very happy for the program that you're doing. How many people do you actually think within the first year of this being open, besides the 300 that you serve now? Are you thinking there's going to be another 200-300 people start coming in within the first year? Do you see it growing? Where do you see it going to? Is it, I guess my question. I don't have a take on the opiate issue other than what I hear. So I mean, I have no idea how many people you think are.
We put on our application that we would increase up to 100, and we anticipated that that might take the better part of a year to get to 100 in that opioid treatment program. It's hard to say if there's that many more that are going to come, that we might hit 150. Hard to say where that will go. Right. I anticipate some of that 300, some of those folks will end up coming over, that they're currently on Suboxone. We have a limited number of prescribers with Suboxone in our community right now. So some of those they're paying cash. If they're going to a private doctor, they're paying cash. And some of those folks may come to our clinic because they would accept Medicaid, so that they would no longer have to pay cash, or we would accept their private insurance.
Jim, the grant that we're going to be looking at, resolution number 2, is $230,000 for startup costs. What are the ongoing costs, and who are those borne by?
The startup is all the furnishings. We had to save everything else, the renovations, all that we had to do. The ongoing cost is about a $1.2 million budget. Some of that is coming in from revenues for fees for client services, and the rest, the net deficit, the balance, we said to the state, if this is something that you want us to do, we're going to need some assistance here. We have a shortage of medical staff in our community, a shortage of clinical staff, that if we're going to be able to attract those folks to work here, then we're going to need, and they supported our application, so we will have net deficit funding coming from the state.
And that funding is going to come through OASIS?
Correct.
Through Community Services?
Correct.
Yes.
In our clinic, correct. Dr. Paisanello will be our prescriber. Correct.
Not necessarily to everybody, but to people that are
If we have
higher risk
problems
for
with diversion, that's what we could resort to.
Right. I've been prescribing Suboxone with Credo for a while. I can tell you, we run a pretty tight ship. People are tested frequently to make sure they're not using drugs that they're not supposed to along with the Suboxone. When we prescribe the Suboxone, we ask the pharmacist to record the lot number on the label of the bottle that the Suboxone is in, which they're not by law required to do, but they're doing it for us. We've got them down to do that. Then every day, the clients have to call in and say, what's the color? And if the color is red, and each client has been assigned a color, if it's red, then randomly they have to come in that day, bring in their used Suboxone wrappers, which we match against the lot number to make sure they have them all there, and any unused Suboxone, make sure they're all there for when they're called in. We do the best we can.
And the same will happen with methadone. The dosing will happen with methadone at the clinic, but they will have a take-home at least one day. We will be open 6 a week, but they will have a take-home. If they're on a 7-day dose, they will have a take-home for Sunday. And then as time goes on and they're doing well in treatment, then their take-homes could be for a longer period, 2 or 3 days, 4 days.
The doses we give intentionally are liquid methadone, which makes it harder for them to hide the pill and then spit it out later.
Is there any security issues that you have to address to have the drugs on premises besides the safe? Is there security for the doctors and the nurses that are going to be administering it? Sending people in that, I don't really know, you're sending people in that are probably less than savory?
They're some of the same population that we're seeing currently. We do have alarm systems set up, panic buttons, that if there's any situation, each counselor's got a panic button in their office, that if they have a problem with anybody. We are also looking and had discussions with a security company about having a security person, not full hours of operation, but on busy times when we're having a lot of traffic and primarily when we're looking to be doing
Meet certain criteria in order to prescribe, which are prescribed by OSS.
The only question I got, Jim, are you limited to the number of patients you can see under this new program?
No.
The doctor himself, I guess?
The max for a full-time doc would be, and 2 nurses, is 300. So that's our maximum capacity that we could do using Dr. Paisanello. We don't anticipate we are going to hit 300.
Okay.
Let's hope not.
The maximum number of Suboxone patients any doctor can have was 100. Now it's being increased to 275.
Oh, okay. The other question I got, Vivitrol, because it does apparently work well. How effective is it with this new drug that's out that's being mixed in with the heroin? Is it still effective with it? Because I'm finding out the Narcan is not being effective or even working in any instance with this new drug that's up here that's mixed in with it. I don't know if the doc's familiar with it or not.
I mean, when they're on the Vivitrol, they won't get it, you know, if they're using heroin with something mixed in, they won't get any effect from the heroin.
Okay.
The other ingredient, I don't know.
But with
what's
that
an
added
opioid.
with this new ingredient, if they did all of a sudden, I was curious as to what that effect would have on the Vivitrol, if it would still protect them or not.
Well, overdoses from opiates, which is what we're seeing, those will be blocked as long as you've got the Vivitrol.
Okay.
Problem is, the Vivitrol sounds great for all of us.
Right.
There's not a lot of people lining up in any clinic to get
Correct.
the Vivitrol.
Right.
This Vivitrol has been around, and naltrexone's been around for years, 60s and 70s, and there's not a lot of people that are lining up and saying, give me that Vivitrol. We'll have all three available, and with the doctor and the clinicians assess what's the most appropriate for that person.
I was up to look at the clinic in Plattsburgh last week, and they have 90 people in the program and one on Vivitrol out of the 90.
Oh. Okay.
Great, thank you very much.
Thank you, appreciate it. On to resolutions.
The first resolution this evening is authorizing an agreement with the Northern New York Seniors Incorporated for the provision of in-home housekeeping services.
Can I get a motion, please? Mr. Ferris, and a second. Mr. Drake. All in favor? Opposed? Carried.
Next resolution is amending the 2016 county budget relative to opiate treatment program with Credo Community Center for the Treatment of Addictions Incorporated.
A motion, please. Legislator Ferris, Legislator Drake. All in favor? Carried. Sorry. Carried.
Next, accepting the funding for New York State Department of Health COLA for Immunization Action Plan and amending the 2016 county budget in relation thereto.
A motion. Legislator Drake, Legislator Maxon. Discussion? All in favor? Opposed? Carried.
The last resolution this evening is authorizing amended agreement for home health care services to public health in relation to the New York State Department of Health Workforce Development funding.
Motion, please. Legislator Ferris, Legislator Maxon. Discussion? All in favor? Aye. Opposed? Carried. There's some monthly departmental reports. Is there any new business to come in front of the board? Anything from the department heads?
Ginger, just a quick question. Do the newsletters end up on the desk?
That means you have to get up in front of us and talk now.
No. No, we do have the newsletters from Department of Public Health. Every so often we distribute, and Ginger happens to have them with her tonight, so before you leave, we'll pass them out.
Thank you. Anything else? Motion to adjourn? Legislator Ferris, Legislator Maxon. Thanks, David. Forgot all about it. I wrote myself some notes to get started and forgot all about it. Thank you. Thank you. I'll just have Bobby quiet for a couple of questions, or a couple of resolutions. Happens.
Sean's got to back off right now. I'm hoping it stays.
Did she have somebody to check with before we leave tonight, or?
If you call 786-3770, it goes to the on-call nurse, and work. That's what I did. I got here and I before I left the office. So I did that and realized it wasn't, and started playing with it. So I have a supervisor there who will be reading.
What time did she leave?
Whenever she gets her work done. It's nothing set. Whenever she gets ready to go.
So you'll have to have it by Friday. I'll just say these ones. I don't think it'll be
No.
sorry. Yeah.
I'll bring them.
Should I start mine just in case? Oh, yes, yes, yes. Thank
Terrible. Well, it only gets turned on like once in a blue moon, so.
Oh, well, I need it. I got it. I'm not plug it in yet, because my whole calendar and everything is going to be updated.
Okay.
Good. Thank you.
I'd like to call to order the county's Standing Committee for Finance and Rules for their July meeting, and offer privilege of the floor. Anyone care to speak to the committee?
Seeing no one coming to the microphone, we could move on to the approval of the minutes from the last meeting. Any changes, additions, corrections? Hearing none, they'll stand as presented. Tonight we have a presentation. We have a presentation by our auditor, Drescher and Malicki. We have Luke Malicki. Is it Malicki or Malecki?
Malecki.
Malecki. With a name like Montigelli, I try to get people's last names.
Thank you. Good evening, everyone. And unable to come with me was the manager, Nicole Ruff, and Megan Wenak was the senior in charge. First of all, I'd like to thank Karen Christie, the Treasurer's Department, for their cooperation with the entire audit process. And moreover, any department that we conducted our business with throughout the audit was more than receptive to our auditors and cooperative, which as county officials, I think that's important for you all to know that everyone was cooperative with the process. The external audit is an independent verification of your financial statements that they can be reasonably relied upon and, excuse me, and that they're free from material misstatement. Within the reporting package, you'll receive a set of issued financial statements like this, but bounded up. And additionally, you'll receive a report on the New York State Department of Transportation, an auditor's communication letter which goes over key responsibilities and assumptions, and a management letter which goes over any sort of items that we feel the need to bring to the attention of the county officials. Throughout our audit, we do perform certain tests of internal controls, but we do not perform an audit of internal controls. As such, we don't put any sort of opinion on the internal controls of the county. However, some items do come to light throughout our procedures that we do communicate with the audit committee. We met with the audit committee earlier this evening and discussed those items as well as the results of this year's audit, and we met with management on July 11th. Our main responsibility as external auditors of the county is to provide a professional opinion on the financial statements that they are reasonably stated. The financial statements as they are presented are the responsibility of the Treasurer's Department. We solely put an opinion on those numbers. You'll see that on page 1 of the financial statements, our opinion is anticipated, and I'll speak as anticipated because we anticipate that the release of the financial statements will occur within a week of today. Our anticipated opinion is an unmodified opinion, meaning a clean opinion that we feel, given our professional judgment, that the financial statements can be reasonably relied upon. There is one paragraph discussing the implementation of a new GASB that was nationwide, GASB 68 and 71, so no reason for concern on that one. Our auditor communications, as I mentioned earlier, we did discuss these with the audit committee at length earlier this evening. However, we just want to identify a few key points. Is that one of the crucial components of an external audit is our independence. We are independent of the county. Everyone that was engaged and participated in the audit from our firm was independent of the county. The significant accounting policies, these are all summarized in Note 1 to the financial statements, and we have a responsibility to discuss any sort of updates to those policies with the audit committee. We had those conversations earlier today. The only major change this year was the implementation of that GASB that I mentioned. GASB is the Governmental Accounting Standards Board, which oversees the rules and regulations for the reporting requirements of your county. Now, we'll go into a couple of the financial highlights from the year ended December 31st, 2015. First, we'll look at the expenditures, then we'll take a brief look at the revenues and see the comparison of the two of them. 2015 saw a slight decline in expenses, and really the main components of that decline was a small dip in the economic assistance and opportunity. That's where a lot of your mandated state and federal programs are held. That component of the government still continues to be almost a third of your governmental budget, your general funds budget, largely supported through federal and state aid. The general government support declined slightly from last year. A main component of that item is the distribution of sales tax. The county acts as the main collector of the sales tax and distributes to the local communities in the county. Last year, we saw a $1.3 million decline in that distribution of while employee benefits had a slight hike as well, which related to some significant health claims during the year. When we look at the revenue side of things, this shouldn't be surprising to anyone really in the room. The top two items are the largest generators of revenue for the county is the non-property taxes, of which, as I said, 36 million of that 69.5 million that was collected in 2015 was distributed onto local governments within the county. So the net revenue from non-property tax items, sales tax, for the county of Jefferson was 32.7 million at the end of the year. This compares to 33.9 million in 2014, so a decline. Real property taxes increased as the county increased its levy. In 2015, the real property tax items were $52 million. The remaining revenue sources, as you can see, really comprise a small portion of the county's almost $190 million budget, but those all stayed somewhat level except for the decline of the departmental revenue. State aid, you see, is somewhat of a rocky road, and that's just really because of the timing differences between when the paperwork for the grant's filed versus when the actual grant funding is replaced. So if you look at the more long-term average of that state aid line, the third line from the bottom, it ends up being a little bit more leveled off. It tends to be a rocky road just because of the timing of the grants and the receipts. Last year when we presented, there was some pretty large concerns surrounding the gap between the revenues and expenditures in 2014. The graph that you're looking at here puts in a real simple form the revenues and transfers in versus the expenditures and transfers out of the county over the past 5 years. The goal of the county is to have these two lines equal, meaning following the same trend, or at the long-term average following the same trend. In other words, so that we wouldn't be seen as undertaxing or overtaxing the taxpayers of the county. 2014 marked the fourth year in a row of the expenditures actually exceeding the revenues, and last year the amount was at 6.8 million. So that made for pretty uncomfortable conversation as far as where the direction of the government was headed. As you can see, the 2015 numbers rebounded significantly. That decline of revenues and expenditures was only 1.6 million, so an improvement from the prior year of about $1 million, but still not to the point where revenues are exceeding expenditures, which was addressed largely through the 2016 budget process, but the results from 2016 obviously remain to be told. So obviously the concern continues to be to level off the trend to have revenues start to exceed the expenditures to build back some of that fund balance that dipped below the county's fund balance policy, which we'll look at that in a slide in a couple of slides from now. Another way to look at the revenues versus expenditures is to compare them as a ratio. Two items level. In the event that they're not going to be one, because that's pretty much impossible to have a perfect one ratio, you want to have a long-term average of one to make sure that you're consistently not overtaxed, you're not getting in the habit of overtaxing, but at the same time you're not driving the county into a deficit position. And as you can see, the number has been under one over the past 5 years. However, there's been significant improvement in 2015 as you got back to the level of 2011 ratio of revenues to expenditures. So as the treasurer goes through the year and this committee goes through the year, this continues to be a concern. However, the level of concern remains to be untold again with the way the 2016 budget was drafted. I would be speaking a different tune, however, had the 2016 budget not reduced the reliance on fund balance. As you can imagine, anytime this ratio dips below 1, you're dipping into the fund balance of the county. An undue reliance of the fund balance creates a fiscal dependency on that fund balance, but as you can imagine, as the trend continues, that dip into fund balance becomes greater. In 2016, the reliance on, for the budget of 2016, the reliance on fund balance is noted to be decreased by a third, down to $6 million about. So obviously, the county was reactionary on its reliance on fund balance, and hopefully that will translate into a ratio of replenishing some of these fund balances that have been used over the past 5 and 6 years. A big driver of the county's current policies and the current budget is the fund balance policy that was adopted years ago that stated that the county will strive to maintain an unrestricted fund balance, which would be basically your savings account for a rainy day, to be at 2 months of regular operating expenses, which would be about 67% of the annual budget. So if the county's policy reads that if the county falls below 10% or above 10% of this amount, the county manager or the county administrator will address that concern through the budget process, which occurred during the 2015 budget process for the 16 budget. As you can see, the alarm that was sounded in 2014 and 15 has improved the level of fund balance, unrestricted fund balance available to the county. However, it's not to the county's range just yet. As I mentioned earlier, the goal is 16.67 per the policy, plus or minus 10, so the range would be 6.7 to 26.7. So the county is well on its way to getting back within that range. However, there's still a little bit more work to be done, which is again why I tried to emphasize the importance on the reduced reliance on fund balance that was drafted with the 2016 budget. The solid waste fund ended the year with another operating loss of about $354,000. The nature of a enterprise fund is supposed to be self-sustaining in its business. However, as indicated by another loss, and even if we excluded the depreciation amount, that loss still would have been $73,000. In fact, the operating cash flows, which is another key indicator that I look at when we're looking at the enterprise funds in any municipality, is how much cash is coming in versus how much cash is going out, not subject to any sort of investment in capital assets or any sort of reliance on any loans between other funds. And the operating cash flow of the solid waste fund for the year was actually at a deficit of $200,000. In other words, they brought in $200,000 less than they actually paid out to vendors and those kind of things. Furthermore, the solid waste failed to make a payment on the $1 million loan for the capital investment that occurred years ago, and there was, due to that operating deficit, another reliance on the general fund to help subsidize some equipment purchases and to subsidize some of these operating costs. So the net loan now from the general fund to the solid waste is about $1.6 million. So obviously that I did mention earlier in things such as fund balance, capital asset tracking, and some other items that we may have found during related to just tidying up some record-keeping things. That really is my formal presentation, so if there'd be any questions or any sort of comments or concerns, I'd be happy to address those at this point.
Thank you. Any questions for Mr. Malecki?
Okay.
Thank you.
Thank you. Thank you all, and it's been a pleasure working with the County of Jefferson once again.
One thing that was clear to me in the audit committee meeting is that frugal governments, like Jefferson County, have been punished by having a cap that's based on frugality as opposed to opulence. If we had been spending more money, we would be we looked into a position where we could spend more money, but since we were spending less money, we're locked into a position where we get to spend less money, which is like just the opposite of what you should be rewarding people for frugality, not punishing them. A little disappointing. On to resolutions.
First resolution this evening would be payment of legislative expenses.
I have a motion, please. Legislator McBride, Legislator Johnson. Discussion? Hearing none, all in favor? Aye. Opposed? Carried.
Next is setting and reporting standard workday hours to the New York State and local employees retirement system for certain elected officials. I would point out this is a new requirement of state retirement. You've seen it before. We just need to do it every 2 years in line with the term of office of our board members. Next Tuesday, we'll also be adding our treasurer who has submitted a report, but just didn't get a chance to add it to the list today, so you'll see that next week.
Motion, please. Legislator Drake, Legislator McBride. Discussion? Hearing none, all in favor? Aye. Opposed? Carried.
Authorizing the sale of parcel of tax foreclosed property to the town of Teresa.
Motion, please. Legislator Drake, Legislator Nabawanek. Discussion? Hearing none, all in favor? Aye. Opposed? Carried.
Amending the 2016 county budget in relation to the Employment and Training Department.
Motion, please. Legislator McBride, Legislator Drake. Discussion on the motion. Hearing none, all in favor? Aye. Opposed? Carried.
Next is approval of youth service provided for program year 2016 relative to the Employment and Training Department.
A motion, please. Legislator Drake, Legislator Johnson. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Establishing time and place for the public hearing related to the status of implementation of the 2014 and 2015 Community Development Block Grant Housing Awards.
May I have a motion, please? Legislator McBride, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Next is establishing time and place for a public hearing related to the 2016 Community Development Block Grant process.
Motion, please. Legislator Nabawanek, Legislator McBride. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Authorize review of impacts and determination of non-significance in accordance with the New York State Environment Quality Review Act with regards to the County of Jefferson Emergency Radio System Replacement and Upgrade.
Please. Legislator Johnson, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried. Excuse me.
Norman details, sure. Yes. Oh, yeah. Well, whenever you'd like to do it.
That's my question.
Oh, I see. No, let's go ahead and do that. I see. Yeah.
You have a couple of resolutions in front of you. Hopefully they were at your desk when you arrived. And one is before I go too far, I'd just like to thank our airport director, Grant Susi. This is a heck of an improvement in the previous contract. I'd like to have, if I buy a house, I'm having you come with me.
So go ahead.
Read this.
Yes. Authorizing lease with the General Services Administration for office space for the Transportation Security Administration.
Can I have that motion, please? Legislator McBride, Legislator Nabawanek. All in favor? Or excuse me, discussion. All in favor? Aye. Opposed? Carried. And another resolution came forward tonight. This is apparently our desire to move our meeting schedule for committees is not a problem, but to move it for our regular board meeting requires board action. And in order to get it to the board to discuss, we thought we would bring this out tonight.
Specifically, what you have before you is a resolution that would change our rules of procedure to allow for us to, as of post-next Tuesday, have our meetings, the board meetings at 5:30. Just for the record, because we didn't make a decision last month, we talked about it, we need to actually convene our meeting at 7 o'clock next Tuesday. But the action, if you decide to move in this direction, would then prospectively after that date make all of our board meetings at 5:30 on the first Tuesday of the month.
And what can be done can be undone at a future time if there's a need.
Correct. If for some reason, say we get to the end of the year and people don't think it really should be 5:30, it should be 6, it should be 5, it should be 7, I would suggest when we get into the meeting in January, we'll make the necessary changement accordingly.
So could I have a motion, please? Legislator Nabalonic, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Okay.
General Services Committee sponsored resolutions.
There are several. The first one this evening is authorizing agreements for the Federal Aviation Administration, New York State Department of Transportation, and Passrow Associates, and amending the 2016 county budget and capital plan in relation to the acquisition of certain real property from the Watertown International Airport.
Motion, please. Legislator Nabalonic. Legislator McBride. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Authorizing
Legislator McBride, Legislator Johnson. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
authorizing agreement amending the 2016 county budget in relation to the fiscal year 2016 State Homeland Security Program grant.
Motion, please. Legislator McBride, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Next, amending the 2016 county budget in relation to the Highway Department.
I don't know where I got lost.
Did I skip one?
I don't.
How about authorizing agreement amending the 2016 county budget in relation to the fiscal year 2016 Emergency Management Performance Grant? Does that sound better?
Yes.
Okay.
Motion.
That's all right.
Legislator Johnson, Legislator Drake. Discussion. All in favor? Aye. Opposed? Carried.
Now we'll talk about amending the 2016 county budget in relation to the Highway Department.
Yes. Motion, please. Legislator Drake, Legislator Nabalonic. Discussion. All in favor? Aye. Opposed? Carried.
Authorizing agreement amending the 2016 county budget in relation to the state fiscal year 16 Law Enforcement Terrorism Prevention Program grant.
Motion, please. Legislator Nabalonic, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Amending the 2016 county budget in relation to the Sheriff's Department.
Motion, please. Legislator McBride. Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried. We're moving on to Health and Human Services Committee sponsored resolutions.
First one, amending the 2016 county budget relative to opiate treatment program with Credo Community Center for the Treatment of Addictions Incorporated.
May I have that motion, please? Legislator Johnson. Legislator McBride. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Next is amending the 2016 county budget to allocate additional state aid relative to community services program to correctly align state and federal funding.
Motion, please. Legislator Nabalonic, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Accepting funding from New York State Department of Health COLA for immunization action plan and amending the 2016 county budget in relation thereto.
Motion, please. Legislator Nabalonic, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? We've covered the resolutions. And there's the discussion item of authorization for claim settlement.
Turn that over to David.
The claimant's vehicle was totaled. Fortunately, there was no serious personal injury, very fortunately. As you can see from the negotiated settlement here, the vehicle's retail value is a rather cut and dried issue. We've had it evaluated, and that's the retail value that's indicated at the top. The second amount, towing and vehicle charges, the vehicle had to be towed from the scene and it's been stored at a garage. Those are fairly standard amounts that the responsible party for the accident is unfortunately liable for. And the third charge was for the rental of the vehicle, which the claimant has had to suffer between the vehicle, suffer the cost of between the accident and now. We would like to get this settled as soon as possible so that we can at least cut off that increase in charge. As far as contesting the claim, it's not our recommendation that we contest it any further. This was a rear-end type accident. Frankly, it's the driver of the vehicle behind's responsibility to keep a lookout. That did not happen. So we are recommending, and myself, the insurance director, that we pay this claim in the amount that is set forth. Questions? Jim? Rather high.
It's within our purview to resolve this tonight.
Yes, by a vote of this committee, that's all that's required. Any claim over $5,000 and less than 10, this committee can resolve. Over 10, the full board has to resolve it. But by voting tonight, we can get the check cut tomorrow and cut off any additional charges. These were calculated through today.
So it requires an action on your part of the board.
Simple vote.
Simple vote. So, any discussion on this, gentlemen, before we vote? All in favor? And opposed? Guess we'll pay the bill.
Thank you.
Anything else? Nothing, right? Anything to be brought before the committee? Okay.
Mr. Chairman,
that's right.
I do have one more thing. Legislators, if you take your indulgence for half a second, there was something that was kind of late breaking today that I want to bring to your attention. We have a resolution prepared, but at the moment the thought is more to get it in front of you. You can take a look at it and we could waive the rules at our board meeting rather than rush it this evening. But in essence, I think you're all aware of the fact that a key group of people with Paul and with Roxanne and Karen and with Greg have been working very hard for the past year really to look at a new software package for tax collections. And we put that package together and did an RFP, went through a complete assessment process, and ultimately have landed with a recommendation to go with Systems East, which is a company doing a good deal of business throughout the state of New York. Munis, as you recall, was who we thought we were going to have the package with. That frankly just didn't work out. Worked very hard with them to see if we could get their system to integrate with what was happening in Jefferson County, because there's variations on the theme depending from town to town. At any rate, that ultimately was a decision. It's not working, it's not compatible, we need to move on, and we need to bring in other vendors. So that process did take place. There's a good deal of vetting in the meantime. We are now targeting to go online with the next round in January, which is the essence of wanting to move something forward. There's money that's already been set aside in the budget in the neighborhood of $200,000. The bid from Systems East is for $232,000. So there is some transfer of funds that we need to put in place in the capital to take care of the full purchase. Again, we have a resolution ready to go, but this is kind of a last-minute thing, so I really don't want to jam it down your throats, frankly. But what we intend to do is recommend Systems East for the board to consider and approve next Tuesday. At the moment, I would say the experts are in the room. If anybody has any questions in the short term, please feel free to ask, and perhaps we can answer. Yeah, Bill, go ahead. Lean up to the,
sorry. I was just curious if any of the local town tax collectors were involved in, looking at the product.
Bill, the answer is yes. Paul can do it in detail, but the answer is yes, and I would point out that, and these guys can talk to it in more detail, that currently they are using BAS, and there is the possibility with System East, in a relationship with BAS, to continue that for individual towns if they were to choose. That said, there would be a cost of hookup and that sort of stuff that the town would inherit. But for most of the towns who would be willing to go with the Systems East, that would make that transition. But if somebody, a town chooses not to, there's still a way to maintain what they did before. That said, Paul, I'll turn it over to you.
Were they involved in reviewing the RFIs? No, they were not. But what Bob's talking about is this software. There's an agreement between Systems East and BAS where they have built a bridge. So if a municipality wants to stay with BAS, the software and what we get out of the software will be the same. We will have real-time information on payments, whether they pay in BAS or they decide to collect using Systems East. The difference will be is there's no need for us to continue paying a license fee to BAS. So if a town wants to stay with it, the licensing will be with BAS. So we will have a centralized database. So if you pay in Watertown or if you pay in Theresa, we will know at the county almost instantaneously who's paid their bills and what's cleared, what's unpaid. And that was our goal, to have real-time information. And it will be collected on a web portal so people can check the status of their bills online. If the town chooses to allow for online payments, they'll be able to pay through this software, much like BAS.
Did you say there would be a cost to the town if the town wanted to stay with BAS?
Well, I guess that's going to be a decision by this board whether they're going to want to continue a license agreement with BAS for individual towns. Our goal, the licensing year-to-year maintenance is less under this contract significantly by about $18,000 if I remember correctly. So our year-to-year costs are less with Systems East than they were right now with BAS. There's savings moving forward that way too. I have no idea what the individual licensing agreements would be with individual towns. I believe there was one town that if we had stayed with Munis for tax collection, we were in the same scenario where we weren't going to offer, well, first off, their system wouldn't have allowed someone to collect in BAS and be real time. They would have to do exports, we'd have to do imports, and then that's just a cumbersome way to get the information. So I guess it would be up to the towns. The collection process here is much simpler than Munis. It'll be a change from BAS, but it's not anywhere near like the Munis would be. Munis would have been horrible. We would have had nightmares trying to roll that out with the collectors. It was a very cumbersome and not user-friendly, in my opinion. That's one of the reasons we decided to move away from it. Did I answer your question, Bill?
Well, I mean, is there an estimate of what it would cost the town to have a licensing fee? Through your talks, did they give you an idea what they would have to charge a town?
We've not talked to BAS, but I can actually pull, I believe our bills from BAS break it down per town charge, so I can probably get that information for you. An estimate, because obviously once we sever, whether they keep a volume discount or anything like that may be different, but I can get a rough estimate of it per town.
Thanks.
Our goal would be to have all 22 towns, 15 school districts, and 20 villages using the same software. That way our training's easier. It'll be easier to deal with any issues that come up between softwares. The issue, BAS does not offer a centralized collection database. They are, by contract, are not allowed to create a tax collection, tax delinquent software, as I understand. They have an agreement with Systems East. There's a lot of
And to expand a little bit further, regardless of what the towns are doing right now, we had, of the proposals we had 4 proposals from our RFI, and one of them was Munis, which we already basically discounted. The other 2 really just could not do what we're doing right now. We would have been in the same position. This was our best. It's an excellent option. I don't want to make it sound like it's not, but it was our really only option as well.
Systems East has numerous counties, and in our discussions with my counterparts, everyone likes the software. They're good. So,
my only point is, I had several tax collectors contact me when you were talking about going to the Munis system. It wasn't because you were going to that system. It was just because you were going to a different system. They wanted to stay with BAS. So even though you've got a perfect system here chosen, I'm thinking you're still going to hear the same thing from the towns. So that's why my question about, is there going to be a cost? Because I think you're going to probably still get the same resistance.
They can stay with BAS. So if they do not want to make a change, they don't have to. The cost is obviously an issue, and I think I'm not going to say without looking, but so they don't have to change, basically. And if
I think they'll be able to, once they see the software, they'll be able to make the decision whether or not they want to go through that. I think a lot of the resistance before was they got to see Munis, and we got to see Munis, and it was cumbersome, and it wasn't going to be user-friendly. I don't have the same impression of this software. I think this is user-friendly, but it's like anything else. What our desires are, you know, when you look at what the Treasurer's Office goes through when they settle up at the end of a tax collection cycle, everybody's going to have the same information before that meeting happens. Right now, we have to upload information. It's transferred. There's exports made and imports made, and it's not real time. So, another benefit of this is the Real Property Office will be able to take some of the workload off the collectors. So, if there's an error, because we're real time, we can make the corrections to tax bills in our office when they're processed in our office. Right now, they're processed in our office, they're sent out to the collectors, then the collector has to process it too. So that's one thing that'll be taken off the collector's back, is we'll be making the corrections that occur on bills right in the Real Property Office in real time too. So their job will get easier in that respect too.
Any other questions? I have mine, if I don't want to, anyone else? So, walk with me. I'm a town tax collector. I'm using BAS. The
Okay.
county says you can't continue to use BAS, or they say, yes, you can, but you have to use Mid-East, Systems East. You have to buy Systems East, no?
No.
You have to,
We're-
the county would go with Systems East, and you're welcome to use their collection portion. Or you can stay with your current product, BAS, and pay a licensing fee.
And then,
To BAS.
And then BAS will talk to
BAS,
Systems East.
BAS and Systems East already have a functioning,
They call it a bridge, where
Okay.
their software will communicate with Systems East in real time.
So as a tax collector, the only thing changes for me is I got to get my town to agree to pay BAS licensing fee. And we don't know how much that is.
that's
Okay.
So are they going to be informed by reading the newspaper or they pass a resolution or going down this road, or are they going to want something coming down the road?
I think they've been well aware that there's changes coming when we walked away from units. And to your question, Mary is well aware that we're working on something, and she has already informed me that they are staying with BAS no matter what, so. And I think Ron's well aware. And I think if they're allowed that option, that will relieve some of their stress, but it's going to be up to the towns. Well, it's up to this board to decide whether they're going to require the towns to carry the BAS license if they choose that.
In addition to dog control, Mike, we'll also have that.
If anyone has any questions, you can call Roxanne or myself, and at any time we'll try to get you the answers you need.
Anything else for the director? No?
Retirement's sounding pretty good right now.
Again, I'm assuming the lateness of this, your preference is just to let it ride and we'll introduce it at the board meeting. Is that sufficient? You go from there. Okay. Thank you.
Anything else to come before the committee? Sorry, I almost forgot that. Maybe that was wishful on my part. Anything else? I have a motion to adjourn. Legislator Drake, Legislator McBride. We stand adjourned.
You're kind of on a roll. You just got to add